Did you know that you're supposed to live 120 years? Yet most people in the U.S. die in their 60s, 70s, and 80s. Welcome to Longevity with Dr. Wilcox. For the next 60 minutes, we're going to add years to your life. The phone lines are open at 731-1230. That's 731-1230. Or toll free. 1-866-820-5528. That's 1-866-820-KLAV. Now let's bring on the host. Here is Dr. Simmon Wilcox.
Good morning. We're back. I'm Dr. Wilcox, board-certified family physician, former emergency room physician, and a stem cell fellow. We're going to talk about a couple of things today. We're going to talk about antioxidants. We're going to talk about the wonders of metformin. We're going to also talk about vitamin D3 and why it really behaves more like a hormone and why we really should pay attention to vitamin D3. But before I get there, let me answer a question that we've sort of talked about before, but a number of phone calls have come in over the last 3 days, and maybe I said it in a way that was confusing, so let me say it again. We do have the capacity to live to be 120 years of age. When we look at the longevity of a whale, a manatee, a crocodile, they live to be 220 years of age. The longevity is really a function of heartbeats, and we have the same amount of heartbeats that they have. The difference is our heart beats at 60 beats a minute. They can slow their hearts down to 4 beats a minute. We can't do that. If we get under 40, we need a cardiac pacer. So we can't drop to 4 beats a minute. Because of that, we use up that clicker, the number of beats faster. And if we were able to do everything in a perfect fashion, we should easily make it to 120. National Geographic has actually reported on individuals who are 135, 140 years of age. That's rare. But we know that because those individuals had children who were 120, 119 years of age. None of those lived in the United States, and none of those ate our diet, but they made it through without any supplements. So it is doable. Having said that, in order for you to buy into the concept of longevity, it has to be part of your daily life. It has to be part of your conscious reality. Because if it's not part of your consciousness, if you don't believe that you can extend your lifespan to 120, you continue with the same behaviors you've done yesterday. And by continuing that, you won't make the change and you won't make the difference. So then what I tell you simply becomes good cocktail conversation, but until it becomes incorporated in what you do, it will not make a difference. I think most of us will agree about how human behavior works. Most of us will not change until the pain of doing what we do every day becomes greater than the pain of changing what we do every day. Let me say that one more time. Most of us will not change until the pain of doing what we do every day becomes greater than the pain that involved in changing what we do every day. And I'm a culprit of that. The other day I went to a buffet here in Vegas, and as we know, there's lots of buffets in Vegas, and immediately filled up my plate with all the happy foods. And I sat down and looked at my plate and said, you know what, Dr. Wilcox, talking to myself, having my two-way conversation, so you're such a hypocrite. You get on a radio show and you talk about how individuals need to eat, and now look at what you're about to consume. I politely gave the plate back to the waiter and went back to the buffet and picked the choices that made a difference. Because I recognized that the foods I was about to consume are foods that would not make me sick immediately, but 4 to 5 years down the line, continuing to eat that way, the damage from the free radicals and the insult of the free radicals to my heart, to my pancreas, will lead to cardiac issues, will lead to diabetic issues, and will lead to hypertension and a number of other modalities, the chronic disabling diseases that we fight with all the time. So I had to make a conscious decision in terms of what should I be consuming, which I do most of the time, but I realized that I was falling off the wagon just the other day. And I realized how easy it is for us to fall off the wagon relative to food choices that we make. Because every buffet is full of poisons, and you're paying for the poisons, and those poisons make you happy short term. But at the end of the day, we have to make a decision, but it's hard to make the decision if you're not convinced you have the capacity to live disease-free and make it to 100, 120 without being crippled, without being compromised, without being in a nursing home. Now, let's look at the issue of antioxidants. And I'm focusing on antioxidants because I realize that many of us use that term all the time. The importance of antioxidants is that they attack free radicals. Free radicals is what's created in our body by the metabolic process. It's created from your respiratory system when you breathe. It's created from the foods you eat when it's metabolized. It's created anytime your body does an energy function. It creates free radical. It's a byproduct of chemical reactions that are transpiring in your body. The problem with free radicals is that free radicals in turn create damage. Free radicals in turn create cell damage that lead to diseases, that leads to the aging process that makes us look older. So free radicals is a buzz term that you hear all the time. The problem is all free radicals are not equal. Different free radicals do different things. Some free radicals actually will attack the cell membrane and cause damage. Other free radicals will attack your DNA and create damage. Other free radicals will attack your telomeres, which we've talked about on previous shows, and create damage and shortening and unraveling of the telomeres. So all free radicals do different things, and they come from different sources. They can come from environmental stress and places where the pollution is very high. It can come from items that have seeped into our wells, arsenic. It can come from nickel coming from makeup that some men, but most women wear. It can come from a number of sources in our lives in terms of the introduction of free radicals into our bodies. And at the end of the day, it is the essence and creation of the chronic diseases, the cancers, the heart diseases, the strokes, the Alzheimer's, the rheumatoid arthritis, the cataracts. It's all about free radical and the damage related to and caused by the free radicals. So most of us say, well, we need antioxidants. Let's go buy some antioxidants so we can compromise, put in check those particular free radicals. The problem is all antioxidants are not equal, the same way all free radicals are not equal. So you have to be able to make a choice, and many people are making a good attempt, but they're making a blind choice, not knowing which free radicals they need. And not knowing which free radicals they need to put in check. So on the surface, they go in and they buy the vitamin E, they buy vitamin C, they buy selenium, they may get some glutathione, they may pick up some copper. All of those function as free radicals. Even uric acid functions as free radicals. Functions as antioxidants, which will address the free radicals. So your manganese and your zinc acts as antioxidants. Your selenium acts as antioxidants. Your vitamin C can act as antioxidant. Your vitamin E can act as an antioxidant. But which ones do you need? Now, at the end of the day, it's preferable to obtain all your antioxidants by the food you consume. But we're struggling with foods that are grown in soil that's deficient in the right type of minerals, so they may not have the level of antioxidant activity that one needs. So again, it goes back to the need to perform certain tests to determine whether or not your antioxidant levels are where they need to be, and more importantly, determine which antioxidants that you have, which are low, which ones are high, because many of us are taking antioxidants where the level is already sufficient. One of the things we're concerned about, particularly in the stem cell world, where we take the cells out of your bone marrow, the autologous cells, And often in the clinical setting, in the laboratory at the universities, we manipulate those cells, let's say, into cardiac cells in preparation to take those stem cells and inject it into your heart so you get new muscles and new arteries. Well, one of the doctors had a bright idea. Let's add antioxidants to the petri dish that we're using to manipulate the cells prior to going to surgery to inject the progenitor cells, to inject the stem cells into your heart. What we learned was that when we put excess amount of antioxidants into the petri dish in an attempt to protect these stem cells in preparation for going into a person's body, that excess antioxidants was actually creating cellular damage, was actually damaging the DNA. So that you need to take your antioxidants, the take-home message, in appropriate proportions. Now, granted, it's kind of apples to oranges. This was in a petri dish. It was in a laboratory. It wasn't in a person's body. But the point of it is that we don't believe that more is necessarily better. We have to find what the right balance happens to be when you're looking at consuming the antioxidants. Now, again, the best way to do this is by consuming your antioxidants. For the ones that fight cholesterol, you want to look at beans. For the ones that fight cancer, you want to look at cranberries, raspberries, pomegranate. For the foods with antioxidants that fight heart disease, you want to look at purple potatoes, or blueberries, black currants, purple grapes, red wine. For the antioxidants that fight wrinkles, you want to look at apricots, cantaloupes, lemons, pecan, almonds, sunflower seeds. For the antioxidants that fight breast cancer, you want to look at broccoli, Brussels sprouts, and cabbage, and kale. So again, even when it relates to foods, different foods contain different antioxidants, and those different antioxidants fight different free radicals, which go on to create different problems. So in the case of the beans, they fight cholesterol. In the case of the raspberries and the cranberries, they fight cancers. In the case of the red wine and the purple grapes, they tend to fight heart disease. In the case of the pecans and the almonds and the sunflower seeds, they tend to fight wrinkles. And in the case of the broccolis and Brussels sprouts, they tend to fight breast cancer. So again, every food is not the same. Every antioxidant in the food is not the same. What a free radical does to your body is different for each free radical. And you need a coach, you need a quarterback, you need somebody to help guide you in terms of what selections you can make, so you're not just creating expensive urine when you're out there buying those items from the health food store. We're going to go to break. Again, please call in. We're taking calls. Number is 702-731-1230. 702-731-1230. KLAV 1230 AM. 702-731-1230.
Just in time for the holiday season, Dr. Wilcox is offering an exclusive deal for KLAV listeners. Get a free 15-minute consultation with the purchase of a vitamin B12 injection, half price, Myers cocktail, half price, or glutathione injection. For more info, call Dr. Wilcox's office at 702-900-2953. Better act fast. This is an offer on a first-come, first-served basis to a maximum of 10 patients per day. Visit Dr. Wilcox's office in Summerlin, 8751 Charleston, Suite 210, behind Fleming Steakhouse. Don't miss out on this exclusive holiday offer. Call Dr. Wilcox's office at 702-900-2953. Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-900-2953. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-900-2953 or visit his office in Summerlin at 8751 Charleston, Suite 210, behind Fleming Steakhouse. Call Dr. Wilcox at 702-900-2953.
My name is Dr. Simmon Wilcox. I'm a board-certified physician in family medicine. As a physician, I have 20 years' experience with drug and alcohol abuse. But I bring to you a new service at my facility for drug and alcohol. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Call Dr. Simmon Wilcox at 702-900-2953. Once again, that's 702-900-2953.
Today is the first day of the rest of your life. This is Longevity with Dr. Wilcox.
We're back. I think we had a question there. JR, could you share that question with me?
Yeah, Doc, I'm just going through things in my mind as you're speaking here, and knowing some close friends and family members that recently had cancer. A few people have passed of cancer. They didn't really go into their diet and anything else until that came about. I mean, my sister's one of them. She started, everybody, okay, you got to go green and do all the, do the shakes and juice and they seem to do it as a reactive instead of proactive, and I think that's kind of the way we're at.
Exactly, and that's kind of what I was alluding to when we talked about human behavior, that the pain of doing what you do right now every day, you're not going to change until the pain of doing what you're doing is greater than the pain it takes to change it. I always say it's easier to change a man's religion than to change his diet. And in this situation where when cancer's in your face, when you've gotten the label, when now you've taken ownership of the label, then it's clear now that it's a problem. It's clear now I have to do something. It's a lot harder to take someone who's feeling invincible, who's everything is going well. They're driving their cars, they're in their air-conditioned homes, they're eating at the 5-star restaurants. It's a lot easier to tell them you need to do certain things right now to prevent from being in a particular situation 6 years or 10 years or 15 years out, because we can't feel that pain. But we feel the pain immediately once the diagnosis is made. We realize that there's some sense of some finite years here once the doctor's giving you that label. So you're absolutely right there. Patients do it all the time. They're ready to go juicing. They're ready to learn all about antioxidants. But then we're playing catch up.
Yeah.
What we're really trying to do is try to get you to take control now, to try to avoid the fight, or at least drastically delay the fight. Too many of us are fighting that battle at 40 and 50. I'd rather you fight that battle at 110, 115 years of age and delay it by making choices. But the happy foods take control.
Yeah, and it's if you even could relate it, as we're speaking here, Doc, you can relate it to even as much as alcohol. People like to drink, and they drink, but they can feel the effects right away, and the next day if they drink too much and overindulge, they'll have a hangover. Now, the food is actually even more of a silent killer than that, because it's going to sneak up on you and hit you over the head way down the road. Mm-hmm. You're ingesting something that's probably going to have a terrible effect on you.
Yeah, it's not that I'm promoting alcohol, but the one benefit of alcohol, there's a benefit, is that you can, if you drink constantly, you can only drink so much, because finally you'll pass out. You stop drinking. With food, you glutton yourself to death in the morning and glutton yourself again in the afternoon, and do it day in and day out, unfortunately. And it doesn't have that stop button, the same stop button that exists for alcohol.
Right.
And you feel okay. So you say, well, why do I need to change this? Because if it feels good, it must be good for me. And it's not necessarily true.
It's something that seems that we all know, and we're learning more about it as a society, I believe. It's just, again, that's a good statement. It's sometimes harder to change a man's religion than his diet.
Absolutely. Was there a phone call there? I think we have Dana on the phone. Hello, Dana.
Hi. Do I need to turn my radio down, or how can I do this?
I think you do.
Tim is saying yes.
Yes. Yes. If you could turn your radio down, that would be helpful.
Or off.
Yeah, I'm in my car, so.
Okay. Not a problem. Hello?
Hold on a second, yeah.
Okay, we'll wait for you, no problem.
Okay, see if I can do this. It's going through my
We have faith in you. We know you can do this.
going
through your Bluetooth.
through the volume on, yeah. So I don't know how
Why don't you go ahead and ask the question? Don't worry about it.
Okay.
Just go ahead and ask the question.
All right. I have been on, I started out on pain medication due to my knee problem, and I had knee replacement 4 years ago, both of them. And I'm 63 years old, just to give you a quick background.
Okay, no problem.
And anyway, during that time, I ended up getting on oxycodone and Lyrica and Celebrex, and anyway, and I continued taking them because of back problems and stuff.
Okay.
Kind of typical. And I'm wanting to. I started going to a chiropractor about I think I've had 30 visits or so, and I'm kind of on my own though, trying to go off my medication. I'm wanting to get off of it, and I'm doing it. I've started doing it. But I kind of thought, I heard your program, and I thought, you know what, maybe I could, it sounds like that's something you do. So I kind of want to know what I'm doing, to know what vitamins to take. I also had weight surgery, lap band, right around that same time, 4 years ago.
Uh-huh.
So I also dealing with that, too, because I know I'm not eating right, and I just want to get healthy. That's my problem. I've lost 100 and some pounds, and I've got...
Congratulations.
Thank you. I still have 70 to go. I'm kind of... Because I keep eating wrong, just like what you were saying. And I love sweets, ice cream and all this junk, and I keep doing stuff I shouldn't do. So I'm kind of stuck there. And anyway, so that's my background.
Thank you. Thank you for sharing that with us. Tell me, where's your pain located?
Pain right now, I have a lot of back pain, but actually the chiropractor's been helping me with that.
Okay. Well, one of the things that patients don't realize is that every time you lose 5 pounds of weight, you take 50 pounds of pressure off that back or off those knees. So that even small changes in weight make big changes in the amount of pain that you're experiencing. By the same token, someone who has back pain or knee pain, when they pick up that 5-pound nephew or grandchild or child, that 5-pound child is actually putting 50 pounds of pressure on their back, on their knees. That 10-pound bag or pocketbook you may be having on your shoulder, that 10 pounds of a pocketbook is putting 100 pounds of pressure there on your body. So first of all, the weight loss both on the body and not carrying much weight makes a big difference. Yes, you should be on the vitamin C's and the vitamin D3, which we're going to talk about here, some more details in a little bit, in terms of helping to negate the amount of pain that you're experiencing. I typically would recommend that you have a actually blood test done to evaluate all of your antioxidant levels to get them appropriate. And particularly, we're concerned about where are your omegas at, and the need to actually rejuvenate your nerves, because the pain signal is sent to the brain via the nerves, and a lot of times those nerves have been damaged from the free radicals, and that nerves needs repair, and the repair of those nerves happen via the omegas. Are you sleeping at night, Dana?
I said it was back pain. It also feels almost like hip pain too, but
okay.
So yeah, I'm having kind of some issues with sleep because of that.
Exactly. Now, it's very difficult. Most of the body repair happens during REM 3 sleep. It's hard to get body repair if you're not sleeping. So for a lot of individuals, they fail to realize we've got to work on the sleep. We've got to get you sleeping better in order to have the repair process to occur. I do believe if you've been on the opiates, as long as you've been on it, you do need to have a testosterone level drawn, because the opiates will drive down your level of testosterone both for males and females. And there are creams out for females, usually at the compounding pharmacies, that will actually offer female dosages for testosterone and bring those levels up. As you rise, those testosterone levels raise up, you will find that you will have a decrease in the need of the pain medicine you're taking, and will improve your ability to tolerate the discomfort that you're having right now. And then we actually have a formal detoxification titration program in the office for those who can't do it by themselves, because it is hard to do it by yourself. to help them come off the various medications that the doctor's prescribing, but your body's become dependent on it, and so it's hard to resolve that. So we then will give a series of treatments intravenously to correct the deficits, to make a smooth transition so you don't have withdrawal symptoms. Because there are many people who are on the medicine just because they have no way to really come off the medicine. They have no option in terms of how to titrate off the medicine in a way that makes them feel human. So they continue to take the medication despite that. So I hope
I've never abused it.
Uh-huh.
But like you said, I've been taking a long time. I've been taking about 5 years. And my problem is I don't, like I said, I know it's bad for me, and I just want to get off of it, but I want to do it the healthy way.
Exactly. And there's so many people out there just like yourself. They've never abused it. They're taking what the doctors prescribed them, but the body has changed because of it. And so
That's what I've heard.
Exactly. So now you need a rejuvenation, and you need a quarterback to help you with that rejuvenation. Unfortunately, myself as well as the other doctors in training were never trained how to do that in medical school. That's not something we're trained on. It's something you learn after you've exited medical school, something you learn after you've exited your residency program. And we've been doing these type of titrations and detoxification for the past 10 years or so. So that if you're not able to work through it by yourself, we can always do it for you and then send you back to your own private care doctor and let him or her continue the process for you. So we thank you for the phone call.
Okay, so do I just call your office?
Yeah, you could feel free to give our office a call, and the number at the office 702-900-2953, 702-900-2953, and then they can set up a consultation visit for you, and one can go from there. Okay.
All righty, thank you.
Okay. Thank you, Dana. Was there another question there, JR?
It seems like it's the growing problem with the testosterone deficiencies on the opiates. People are taking opiates. One of my son's friends, we talked about him last week, Mikey, and a difference between him and he's a 30-year-old man. You never think he'd be deficient, but he had a car accident and he was taking a lot of opiates. And once he got on testosterone, I noticed I call out the difference is like being Clark Kent and Superman. I mean, it really restored him back to vitality. And, it's just the questions is antioxidants, a supplement. So is there any antioxidants better than others, Doc?
Even though they're not all equal, in our office we push glutathione heavily because glutathione is actually probably the mothership if it comes to antioxidants, and we give that intravenously. It's a naturally produced antioxidant, but it really covers a larger gamut than most of the other antioxidants. So we like intravenous glutathione because we see how it makes a difference.
And I know this, but I want to ask this. The reason you like to do this intravenously is?
Because if I give it to you intravenously, you got it.
Right.
If I give it to you orally, I have to hope you absorb it. And I have no way to measure if you really absorbed it or not. It's short of going back, pulling your blood work again, sending it back to the special laboratory in Texas.
Right.
They want $300 to get an answer. And it's this time delay. If I know you have an issue today and we want to resolve that issue in the next week or two, the fastest way to resolve it is to administer intravenous glutathione, which serves both as an antioxidant and also serves as a chelator to pull out various toxins there in the body, because many of us are walking around with toxins that we're unaware of, those with mercury in our mouth. Mercury is
kids getting the fillings and things of that nature.
Exactly. The EPA has said to get rid of mercury, you have to bury it 1 mile underneath the ground. Well, if you have to bury it 1 mile underneath the ground, why is it in our kids' mouth? So it's very toxic. So there are things that we do, and glutathione is one of the things we use, and one of them to do that. I think we're going to go to another station break. Again, if you have a question, please call us at 702-731-1230, 702-731-1230. That's KLAV 12:30 a.m.
We'll be right back.
Thank you, JR.
Just in time for the holiday season, Dr. Wilcox is offering an exclusive deal for KLAV listeners. Get a free 15-minute consultation with the purchase of a vitamin B12 injection, half price, Myers cocktail, half price, or glutathione injection. For more info, call Dr. Wilcox's office at 702-900-2953. Better act fast. This is an offer on a first-come, first-served basis to a maximum of 10 patients per day. Visit Dr. Wilcox's office in Summerlin, 8751 Charleston, Suite 210, behind Fleming Steakhouse. Don't miss out on this exclusive holiday offer. Call Dr. Wilcox's office at 702-900-2953. Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-900-2953. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-900-2953 or visit his office in Summerlin at 8751 Charleston, Suite 210, behind Fleming Steakhouse. Call Dr. Wilcox at 702-900-2953.
Just about 4 years ago, I was longboarding, hit the side of a truck. This coming spring, I will have had 7 different surgeries. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but how often I would take them did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. That's where the help comes in. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr. Simmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice is I've re-engineered how we approach the detox rejuvenation process. We offer a series of intravenous treatments. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
For more information on this miraculous treatment, call Dr. Simmon Wilcox today at 702-900-2953. Once again, that's 702-900-2953.
Longevity with Dr. Wilcox continues. Here again, your host, Dr. Simmon Wilcox.
We're back. There's a question that came in during the break, and Tony, what was that question that was asked about?
The question was, is there a way that you can trick your taste buds into making things that are good for us taste better?
I wish I could, because as a parent, I would love to be able to trick my kids.
Me too.
They're adults now, but it'd be a lot easier to get all the vegetables into them. The short answer is that there's no formal way. The issue with taste buds, the issue with the tongue, because that's where the taste buds live, is that individuals have different concentration, different densities of taste buds. I may have, for argument's sake, 50 taste buds, but you may have 300 taste buds, so that you're going to be a lot more sensitive, a lot more aware of the difference in tastes, and therefore potentially a lot more choosy in terms of what you're allowing yourself to ingest. So there's not a good way actually to trick the taste buds. For kids, for example, the whole process of juicing their vegetables has become more of a fad. Add apple juice to the kale and the cabbage, etc., and juice it in so that they tolerate it a lot better than they would otherwise. But it's a difficult process. It's not easy to quote trick the taste buds. Because if we had that magical pill, I probably could sit on the beach and sell that one all day long.
Actually, I've always found that the kids are easy to get them to eat whatever you need to. It's the adults where it really gets tricky.
It goes back to changing a man's religion. It's difficult because we are moody and we feel invincible. If we don't have a challenge in front of us, we will tend to continue to do what we did yesterday. We won't change our habits for tomorrow. Let me take a moment and just address another topic, and we'll probably come back to antioxidants in the upcoming shows. There's some other items that we haven't really gotten to. But just want to look at the issue of Metformin. Metformin is a drug we all know as something for type 2 diabetes, a pill you take to get your diabetes under control, and that's worked very well over the years. But there is a number of hidden, almost off-label benefits to metformin that has become apparent that we use in our practice. Again, it's off-label in terms of what happens with metformin. But for those people who are diabetic and those people, surprisingly, who are not diabetic, who take metformin could possibly benefit from. We recognized when people was on metformin that many of those had decreased cardiovascular incidence. Many of those had decreased evolution of certain cancers. They had improvement in their weight. They had improvement in their cholesterol while they're on metformin. So the question was asked initially, was this because we control their sugar? But when we began to give metformin to people who were not diabetics, we started to see the same type of benefits. We saw individuals who had reduction in weight, so we use it in the practice off-label for weight reduction. It gives about 4 pounds a month is what I normally see. And so some people actually experience the 4 pounds a month. Some individuals, unfortunately, use that to eat an extra 3,000. Every 3,000 or so calories gives you the extra pound, so use it to eat extra calories without gaining the weight. So it goes both ways. The other individuals who have polycystic ovary disease improve on metformin, even though they may not be a diabetic. POS is a syndrome that many females have. And we've become, it's pretty much standard of care now to use that metformin for that. We've also seen shown up in the literature now that metformin improves your mental clarity and your mental agility. One of the things that has not been crystal clear in terms of metformin and its response to cancer, but we do see that metformin has an impact on cancer, upwards of a 25% reduction for some individuals with the breast cancer. The problem is, this is all in studies now, the problem is that we don't know what the dosage is for cancer. That some studies are saying 20 to 30 times the dose you take normally is what you have to take to address a cancer issue with metformin. But the point is, metformin is more than just a diabetic drug, and I just want to raise that for a lot of individuals. That metformin, which, and I don't own any of Walmart, but you can go to Walmart and get metformin for $5. Is on that discounted list of medications. But so it's a very accessible medicine. It's a very inexpensive medication, yet it offers a lot of benefits relative to cardiovascular system, relative to weight loss, relative to polycystic ovary disease, in addition to what it does for the diabetes. And we're still trying to figure out exactly what dose of metformin we should use relative to cancer. But there are some circles that are suggesting that we will probably end up recommending metformin as a drug for every female in America to take to prevent the development, to reduce substantially the potential development of breast cancer. And that's the discussion is still on the table. The jury is still out on that, but I strongly believe the jury will come in with a yes. We just figure out what is the dosage we're recommending for prophylaxis for females, whether they're diabetic or not, relative to consuming metformin and preventing, or at least decreasing the chance of the evolution of breast cancer. Just a tidbit for you, keep it in the back of your head. But individuals go to their doctors and talk to them about. I'm sorry.
No, I was going to say, I've been on metformin for about 3 years now, Doc, and I'm not a diabetic, and just for those same exact reasons. I was traveling back and forth doing some consulting work in the Bay Area in San Francisco, and staying with a friend of mine that knows nutrition very well, and he was on it, and he was telling me the benefits of it, so I started taking it as well. When I came back here to meet with my general practitioner, my doctor, he goes, "What are you doing on metformin?" I go, "Well, here, doc, here's some of the benefits." I told him the benefits as he just reiterated, weight loss, cardiovascular increase, and it attacks cancer, and they're finding this out. And he looked at me and goes, "Oh, okay." He hadn't, unfortunately, he didn't have any idea, but the last time he's ever read a journal, I couldn't tell you. The poor guy's so busy.
In defense of my colleague. We are very busy, and there's so many different things that are coming out, and it's hard for us to keep up with every single item. And so often we'll make a decision to stay with what's proven and what's known and not go outside the box, because it's probably the safest thing to do. so that there will be things that the doctors, you go to doctors and talk to them about, they won't know. There are things you come to me and talk about that I won't know. So in the sense of to my colleague, that there are things that we don't know. But I'm willing to be open to it. If a patient brings me something I haven't heard about.
Sure. Do some
and
research.
try to research it and decide, because the patients have the time to read, and the insurance companies have pressed our backs against the wall in terms of putting out volume. But thank you for sharing that with me.
And I didn't mean to attack any of the doctors at all. I just what I was saying is that I noticed that he's basically taken his health in his own hands, and he's done a lot of research on the different things that he takes. So when he goes to his doctor loaded with different information to help his doctor out, because he didn't have the time.
Yeah.
So I guess what I'm saying at the end of the day is if you feel, research your own health, take a look, take some time.
Well, the whole point of this show is empowerment of the listeners with information, so they can take control of their health care, so they can better have a more educated dialogue with their health care provider, and they both can grow. The patient can grow in their understanding of how to control their health, and the doctors will be triggered to understand what do my patients really want in 2013 and in 2014, because things change, people's desires change, and the way individuals view themselves in terms of their relationship with their doctor will change over the next 4 to 5 years. So doctors just simply have to have an open ear and hear what the patient is trying to suggest, and what path they're trying to go down, and give them the appropriate guidance. Absolutely.
Yeah.
Let me just talk for a moment about my favorite, which is vitamin D3. Vitamin D, if you consume it by itself, does nothing for you. Vitamin D has to be converted from D to D3 by sun exposure to the skin. And as I said before, unless you're naked by noon from 12 to 2 every day with no suntan in solution, you are going to be vitamin D3 deficient. And that's 90% of America. And lifeguards probably get away with it, but 90% of America is in trouble with vitamin D3. Vitamin D3 is not just a vitamin. We call it a vitamin, but it acts a lot like a hormone, like calciferol. It behaves in a way that it improves and is a vital. Calciferol is a hormone that's vital for your calcium metabolism, for bone metabolism, for your neuromuscular function. So there are a number of things in the body that, in terms of functioning, that you need vitamin D3 for. So if someone had to choose which item to actually purchase relative to items they buy in a health food store, I would strongly say vitamin D3 needs to be on your shopping list. And the dosage needs to be around 5,000 units a day. Many people are on 200, 300, but the new research is saying 5,000 a day. It makes a tremendous difference at the end of the day. I had one person I put on vitamin D3. I actually put him on 5 items, but he could only afford the vitamin D3. He happened to be overweight at the time, and came back to me 3 months later, 60 pounds down. I mean, wow. Just allowed him to release the water weight that he was carrying, and he was happy, and I was surprised.
I think we have another call holding. Sheila,
how you doing?
Hi, Dr. Wilcox. Just want to say thank you so much for your valued program. I'm enjoying listening to it, and I just discovered it a couple weeks ago, and I really appreciate your information, especially on digestion and all the probiotics and antioxidants that we need to be doing. So I recently converted to a plant-based only diet, and so I'm really thankful for your information.
Well, thank you. Thank you for calling in. It's always useful to know what people feel about what we're doing, because we kind of function in a vacuum here at the radio station. I see these 3 guys in front of me, and I don't see anyone else. I don't know if anyone out there in the rest of the world, cyberspace.
That's why I wanted to call, Dr. Wilcox, to let you know that we are out here and we are listening, and we appreciate you greatly. So keep up the great work, and Merry Christmas to everyone.
Thank you. What state are you calling from?
I'm calling here from Las Vegas.
Okay.
My phone number, I'm from California.
Okay.
But I live here in Las Vegas.
Very good. Well, thank you much for that input. Thank you for your feedback. We welcome that.
Definitely.
Absolutely.
All right. Have a blessed day.
Okay. Merry Christmas to you. I asked what state was you calling from. We have a number of listeners I've learned over the last couple of weeks who are listening to us on the internet in Texas and in California and different parts of the United States. So I've been surprised. I even got an email for someone from the Philippines the other day who I actually met when I was there about 5 months ago, and they apparently listened on the radio to the show. We're taking calls, 702-731-1230, 731-1230. This is KLAV Station 1230, KLAV Station 1230 AM.
We'll be right back.
My name is Dr. Simmon Wilcox. I'm a board-certified physician in family medicine. As a physician, I have 20 years experience with drug and alcohol abuse. But I bring to you a new service at my facility for drug and alcohol. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Call Dr. Simmon Wilcox at 702-900-2953. Once again, that's 702-900-2953. Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-900-2953. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-900-2953 or visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-900-2953. Just in time for the holiday season, Dr. Wilcox is offering an exclusive deal for KLAV listeners. Get a free 15-minute consultation with the purchase of a vitamin B12 injection, half price, Myers cocktail, half price, or glutathione injection. For more info, call Dr. Wilcox's office at 702-900-2953. Better act fast. This is an offer on a first-come, first-served basis to a maximum of 10 patients per day. Visit Dr. Wilcox's office in Summerlin, 8751 Charleston, Suite 210 behind Fleming Steakhouse. Don't miss out on this exclusive holiday offer. Call Dr. Wilcox's office at 702-900-2953.
You're listening to Longevity with Dr. Wilcox. The phone lines are open at 731-1230. Now, here again, your host, Dr. Wilcox.
Hello, welcome back at the bottom of the hour. Someone asked what was our email. Tony, do you have the email address that you can email the questions to?
You can email us at there's actually a few of them, but the easiest one that you can remember is Infinity Medical Consulting at gmail.com.
Infinity Medical Consulting at gmail.com. Infinity Medical Consulting at gmail.com.
Or you can also email us at info, I-N-F-O, at infinitymedicalconsulting.com.
Okay. Thank you, Tony, for that clarity. Tony's our INT genius, and he works out all the particulars for us all the time. I'm just looking at the DJ. Was that a question? That's
Caller.
Who's calling?
We
us
got a
there?
caller.
Okay. Another caller. Hello, Christy.
Hello, how are you?
I am stable. How are you?
Good.
Okay. You have a question for us?
I'm sorry?
So you have a question for us?
Yes, my question is about my diet.
Okay.
I don't eat anything but dinner, and during the day, all I have is Red Bull and energy shots.
You sound like so many people I know. So, the question in particular is what?
Well, how bad is it for? I have thyroid disease. Well, I know it's bad for me. That's
but how bad is it really? Okay. A couple of things. First of all, if you have any concern about your weight, you can't afford to skip breakfast and lunch because your body will behave like you're in the Sahara Desert and not knowing when it's going to receive food again, and therefore it will slow down your metabolic process. And eating once a day actually will make you gain weight, and it will slow down your ability to lose weight.
Okay.
On the issue of Red Bull, we're actually going to do a whole talk show on Red Bull. That's how problematic
good.
It happens.
I'll be your first caller.
It happens to be that the problem with Red Bull and the energy drinks, and I was an ER doctor, and when individuals come into the ER with these rapid heart rates, 120, 140, 150, and we do this whole cardiac workup and forget to ask them, were you drinking energy drinks? Were you drinking Red Bull? And often after we've done $1 million workup and it's come back negative, we find out that, yes, that's what they were doing. They were drinking. And people are consuming, as you probably know, 5, 6, 7, 8 cans a day. And the Rockstar drinks, etc. All these drinks can have a negative impact on your cardiovascular system. But from a nutritional standpoint, they also create a deficiency, so that the more you drink, almost the more you need to drink, because it creates nutritional deficiencies within your body. It was, and I have to go back and do the research again, but I think it was the German army that finally banned it, Red Bull, because of the damage it was doing to the livers of the individuals there.
Lovely.
Yeah, lovely. So you have to, choose your poisons. You can spend your money on whatever you want to, but at the end of the day, as much as Red Bull is illegal, Red Bull, and I don't mean to offend the owners of Red Bull, but the reality is that there is an issue. It doesn't qualify as a nutritious drink. It gets you through the day or gets you through the night and allows you to be functional. And I'm a victim of it too. I'll get my double shots and caffeine to get my Red Bull in the past. But once I learned that there was a problem, I began to back off. But many of us don't recognize that not only does it give you rapid heartbeats, but it gives you a decrease in your nutrients. And that's not good. So often we bring patients in, we check their nutrients level, we give them the supplements they need because of the amount of Red Bull they're consuming. But thank you for calling. Thank you for having the courage to call. So many people will call us after the show because they're afraid to share their information on air. But I thank you for calling in and sharing that with us. So we will be doing a show in the near future just on Red Bull and giving you all the details about the problems of the energy drinks.
Yes, and if you want to change your diet, we can help you.
Well, the thing is, I have a thyroid disease, so you're telling me to cut out the Red Bull and to eat even if I'm not hungry.
Well, yeah, and I'm not saying eat heavy. If you simply was to indulge in yogurt in the morning, a frosted yogurt in the morning, and whole wheat bread.
I love how you say indulge. I love it.
Just to stimulate your body so they know that you're going to be okay, that you're not in the desert, that food is coming, that it's a lot easier for your metabolic processes to occur, as opposed to trying to absorb everything in one setting a day. So you can test the waters and figure out what works for you personally. For each one of us is different. Okay, but feel free to come in. We'll be well glad to sit down with you and show you how to, get off the Red Bull. But the reason you were taking Red Bull is because of lack of energy. We show you how to gain back that energy that was missing, which was the original reason you was taking the Red Bull to start with. So we can help you with that.
Perfect.
Okay.
Thank you so much. I will watch for that.
Okay, thank you for calling.
See you next week.
It's been a good show. I again thank those who chose to call in and share their personal information. I'm on air. You're still welcome to email us, as many of you have done already, and those who like to call in after the show to ask more personal questions, feel free to do that. We're located there on Charleston right behind Fleming's Steakhouse.
8751 Charleston, Suite 210, or call us at 702-900-2953. See you next week. Right, Doc?
It's been a good show. Take care.
Join us every Monday, Wednesday, and Friday, 11 p.m. to midnight for the paranormal and beyond. Join host Michael Knight and Lindsay Knight as they investigate the unexplained and most controversial mysteries of the world. The paranormal and beyond, where the paranormal lives on and conspiracies exposed. The paranormal and beyond, Monday, Wednesday, and Friday, 11 p.m. to midnight. Brought to you by Knight's Paranormal Research Society.com.